Eye injuries can happen suddenly and unexpectedly, but knowing how to respond can significantly reduce the risk of long-term damage. In today's video, we're going to explore in depth how to treat various eye injuries, from minor irritations to serious emergencies, so that you're well prepared if such an event occurs. Whether it's at home, work, or outdoors, the information in this video could be life-saving. First, let's talk about foreign objects in the eye, like dust, sand, or small debris. This is one of the most common types of eye injuries. If something gets into your eye, your first instinct might be to rub it, but this can cause more harm. Rubbing can scratch the cornea, which is the clear, protective outer layer of your eye. Instead, start by blinking rapidly to encourage the object to come out naturally. If that doesn't work, try flushing your eye with clean, lukewarm water or a saline solution. You can do this by tilting your head back, holding your eyelids open, and gently pouring the water over your eye from the inner corner outward. If the object still won't come out, or if you experience persistent pain or vision changes, it's time to seek professional medical attention. Now, let's move on to chemical burns. This type of injury can happen in the blink of an eye. No pun intended. Household cleaners, industrial chemicals, or even beauty products can cause severe damage to your eyes. The moment you suspect a chemical has entered your eye, rinse it immediately with clean water. Don't wait. Even a few seconds can make a huge difference. It's important to rinse for at least 15 to 20 minutes, making sure the water flows away from the unaffected eye to prevent further contamination. After thoroughly rinsing, seek emergency medical help immediately. This step is crucial, as chemical burns can worsen if left untreated, potentially leading to permanent vision loss. If you're ever faced with a blow to the eye, like being hit by a ball, a fist, or any blunt object, the first thing to do is to reduce swelling. Apply a cold compress to the area around the eye for about 10 to 15 minutes. Make sure you wrap the cold pack or ice in a cloth so you don't apply direct pressure to the eye. While this may help reduce swelling and bruising, pay close attention to your symptoms. If you notice any changes in your vision, persistent pain, or blood inside the eye, these could be signs of a more serious injury, like an orbital fracture, which requires immediate medical attention. Now, let's discuss the more severe cases, penetrating eye injuries. This happens when something sharp, like a piece of glass or metal, punctures the eye. It's critical that you do not attempt to remove the object yourself, as this can cause even more damage. Instead, find a clean, rigid shield to cover the eye. This can be something like the bottom of a paper cup or any sterile dressing. The goal is to protect the eye from further contact. Secure the shield in place with bandages, being extremely careful not to put any pressure on the eye itself. Seek emergency medical assistance immediately. In this case, time is of the essence. It's also worth mentioning that any type of eye injury, even if it seems minor, should be monitored closely. Symptoms like blurriness, excessive tearing, redness, or light sensitivity can indicate that the injury is more serious than it appears. When in doubt, it's always better to have a professional examine your eye to prevent complications like infections or vision loss. Now, let's briefly discuss prevention. When it comes to eye injuries, the best treatment is often preventing them from happening in the first place. Wear protective eyewear when you're doing activities like woodworking, using power tools, or handling chemicals. Even in sports, goggles can prevent sudden trauma to your eyes. It's easy to forget how delicate our eyes are, but taking a few extra precautions can go a long way in keeping them safe. Lastly, a quick reminder. Always seek medical attention for serious injuries, and don't rely on home treatments if symptoms persist. And if you found this video helpful, be sure to subscribe to my YouTube channel, First Aid Academy, for more in-depth guides on handling emergencies and staying safe. Your health and safety are my top priority, and I'm here to help you stay prepared for anything. Thank you for watching, and I'll see you in the next video. Stay safe.